Welcome to Houston Newsmakers Extra, here with Ken Janda, the president and CEO of Community Health Choice. It is a nonprofit organization. We talked about that, and it's very interesting because any profits you get, you go put them back into the system, hopefully to make the premiums even less for people who are trying to get health care, correct?
That, and we also are doing more to try to figure out how to expand access for low-income families. So we're supporting the federally qualified health centers, and we support building new clinics for low-income people with that, because we think access to health care is beyond just having insurance. You can have insurance, but if there's not providers that are willing to take you with your insurance, then it doesn't help to have insurance. And so we've been actually helping build capacity in Houston, as well as looking at other things that impact health insurance costs.
We've been talking about the Affordable Care Act and its future, what it may be with what's going on in Congress. One question I have is, how affordable is it? I mean, the Affordable Care Act was made to make sure that people who may not have access because of cost, they would have a better chance to get health care. How affordable is it compared to what it could be? Based upon what's going on in Washington, D.C.
Well, the way the Affordable Care Act works is that there's subsidies that are available to low-income people and people that make below certain levels of the federal poverty level. So if you make less than $50,000 a year, you start getting subsidies. And so actually, for people who get subsidies, even though insurance premiums have risen a whole lot, so have the subsidies. So the very low income people that are eligible for the Affordable Care Act haven't been hurt as much as actually middle class people who are buying individual insurance policies. What's driven up costs so much for us is, first, there's real medical inflation out there, especially around prescription drug costs. Prescription drug costs are just exploding, and the number of prescriptions and the cost of those prescriptions is increasing. And that's driving up premiums for employer-sponsored insurance, for Medicare, for Medicaid, as well as for people covered under the Affordable Care Act. The second thing that has driven up premiums so much under the Affordable Care Act is there was this individual mandate that was supposed to force everybody to buy insurance. But frankly, in Houston especially, we have hundreds of thousands of people who are still just paying the penalty and do not have insurance. And so what we've got instead is older people with more medical conditions that need more services are the ones who are actually buying, and that's rising prices as well. If Congress now takes away the individual mandate, that's going to cause premiums to go up even more, because people will wait until they're sick to buy insurance. The third thing that Congress and the President have done is that there was a second form of subsidy for some low-income people called cost-sharing reductions. And those cost-sharing reductions were to say, if you're low income and you buy a policy with a $2,000 deductible, you may not be able to afford that deductible. So there was an additional subsidy that we were given as insurance companies to cover the cost of those, and waiving those deductibles, waiving those co-payments for people. And those are the payments that in October, the President announced that he would no longer pay. We've now had to build in that into our premiums. So our premiums have gone up another 15% because of that. And so the activity that's gone on in Washington has really compounded a problem that we already had.
And that was politics, wasn't it? Taking that number away?
That is absolutely politics. And we hope, we are very big supporters of what's called the Alexander Murray bill, which would restore those cost-sharing reductions and do some other things to stabilize the market.
But I've seen that money that they wanted to put back in was not quite enough to do what it needs to do. That it's putting money back in, but it's still not as much as it needs to be put. Because you would say any amount of money back in is better than nothing.
It would help a whole lot, yes. And actually, Chairman Brady from here in Houston has supported a similar but not identical bill to restore those funds. We think that makes a lot of sense, rather than it being paid for just by the people that are buying policies, but spread broader. We're using those federal funds makes a lot more sense. We could reduce our premiums by 15% tomorrow if Congress would act.
You know, my conversation with you and others about health care and around it and whatnot, it makes me realize that, and I've realized it for a long time anyway, to be poor really is not a good thing if you need health care. It is really a difficult thing. Medicaid is just not, and it could be expanded, but that's not being expanded, and that's part of politics too, is it not?
Yes, that's absolutely political, because Texas could expand Medicaid to certain adults and get 90% of those dollars coming from federal dollars. It would be great for the economy of Houston. It would be great for the safety net providers, the hospital district, the federally qualified health centers, the emergency rooms that people are overrun by people with no insurance. We're really not having the right kind of conversations about healthcare policy in Texas right now. And I had frankly hoped that with a Republican administration, we could actually start having some of those conversations about what could Texas do in a unique kind of way. And yet we're still in this, we just have to repeal, and we can't really talk about what that replacement would look like. Because the replacement could be actually better than the Affordable Care Act if we would talk about it. But so far it's just been caught up in politics in Washington.
Being a nonprofit person, typically I find most nonprofit people are optimistic about, eternally optimistic. Are you optimistic? Is there anything optimistic that you can see down the horizon about medical care?
I am optimistic because I do think that finally now, because of all the problems in Washington, and recognizing that in some of the individual insurance companies like Aetna and Cigna, Humana have all exited the individual market. You can't buy an individual policy from them anymore because they just said we can't deal with all this uncertainty. That has finally gotten the attention in the governor's office, and so there's good conversations starting to happen in Texas about what we could do to actually cover more people and do that more affordably in Texas under what's called a 1332 waiver under the Affordable Care Act. So if the Affordable Care Act continues, there's real opportunities for us to do something that would lower premiums and cover more people in Texas, and that's what we need to do. I'm glad to end on an optimistic note. I love that. Thank you, Ken. Appreciate your time. Thank you very much. Appreciate it. Good to see you again. Good information for everybody here. Newsmakers Extra. Share it with your friends. Important information. Thank you, Ken.